Hello and welcome to Learning Module 2. We're going to look at well-being, the physiological and cognitive components of it. Normal age-related physiological changes occur gradually. Some of them start showing up in middle adulthood, some of them occur in later adulthood. Some of them are quite obvious and visible, such as the graying hair and wrinkles that you're looking at right now, and some of them are not so visible to us, such as the changes in our internal organs. We measure these changes in terms of functional capacity. Age-related physiological changes do not necessarily have to mean that one's quality of life is greatly diminished. In fact, because these changes occur gradually, many of us make modifications and adjustments based on them on a gradual basis. So if you think about yourself and other people around you, you could probably come up with a pretty long list of things that we do to adjust to our aging bodies. Older adults are at a higher risk for disease than our younger people, though most older people still rate their health status as satisfactory. Health status refers not only to an individual's physical condition, but also to their functional ability in various social and psychological domains. So health affects and is affected by one's social environment and their psychological well-being. And there's no doubt that health status is inextricably linked to an older person's quality of life. We'll take a look at the common chronic and acute diseases of old age. The top three causes of death are heart disease, cancer, and stroke. All three of these are chronic conditions. And then many of the other common chronic conditions associated with aging are very well known to us. Arthritis, osteoporosis, COPD, diabetes, and other conditions related to our various bodily systems, such as our urinary tract and our intestinal system. Chronic diseases do affect older persons differently based on their race and ethnicity. We'll move on then to talk about the cognitive changes that are common in later life. We'll look at the relationship between aging and cognitive function, including intelligence and wisdom, as well as factors that affect learning in old age and age-related changes in memory. We'll look at theories of personality, and we'll discuss mental disorders in old age, and we'll talk about dementia, different types of it, the most common, of course, being Alzheimer's disease. Studies and research suggest that learning and memory function in older adults appear affected differently. There are different types of memory, and not all of them are affected equally and at the same rate as others. We'll talk about how it's difficult to detect mental disorders in aging and therefore to treat them and measure them. Of all the mental disorders, the most common is depression, which is, of course, a key risk factor for suicide. Dementias, such as Alzheimer's disease, are not inevitable, and they're not considered part of normal aging. Some forms of dementia are reversible, while others are not. Far fewer adults suffer from mental disorders such as paranoia and schizophrenia, and that's more common if the older adult has also suffered from these types of conditions in middle adulthood. Additionally, alcoholism and drug use are more common in younger generations than older generations. So these kind of conditions do respond well to treatment in older adults and to psychotherapy, but generally speaking, psychotherapy is underutilized by older adults. So what we find is that it's best to try to, or often most successful, if these types of interventions are integrated into medical services or social service programs that older adults already are utilizing and frequenting. Enjoy what is ahead in this learning module.